Thanks, as always, for joining us on New England Lifestyles. Cancer, as we know, is an ominous word. All of us fear hearing that there's a possibility that we'll be fighting cancer. A lot of cancers get a lot of press because they impact a lot of people, but there are many, many forms of cancer, and unfortunately, they take a lot of lives. I think it was last year, a good friend of ours who used to work in sales, Dana Jackson, I had met her husband, Jeffrey Cohen, many times. And the thing I loved about Jeffrey was he loved music. I'm the music director here at the Odyssey Cluster. And every time I saw him, he was so passionate about talking music with me. And he was such a guy who was full of life. And suddenly I saw posted on Dana's webpage, her Facebook page, that he had lost his life to appendix cancer. And that stunned me. I had never even heard of appendix cancer. So I wanted to have a conversation about the reality of an underreported but deadly cancer that took a life of someone I know and liked very, very much, appendix cancer. So joining us on the show today is Dr. Laura Lambert, who is a professor of surgery and the director of one of the malignancy programs at the University of Utah. She studied here in Boston, got her medical degree at Harvard. Dr. Lambert, welcome to the program.
Thank you. Great to be here.
Yes, stunning. When I saw this, I was like, I did not even realize that there was a form of cancer, but I'm finding out more and more that there are a lot of hidden cancers that can sneak up. Tell us about appendix cancer. This is one of these organs that you don't even think you need, and I don't think you do need, but it can cause a great deal of problems, and obviously it can take a life. What is that all about?
Yeah, no, you're actually absolutely right. And it often comes as a shock to people who end up with the diagnosis because most of them often go in for thinking they have appendicitis. And they then, wake up after they have their surgery, they have their appendix removed and find out that they actually had a cancer that was causing their symptoms. And again, this is a type of cancer that it doesn't tend to let you know it's there until it's really advanced. The appendix cancers and tumors of the appendix tend to spread through the abdominal cavity, and there's a lot of space in there. They tend to grow on the surface of the organs within the abdominal cavity, and and ultimately they can start to cause some discomfort or abdominal distension, or maybe impact bowel function. But again, people don't really experience those symptoms until the tumor is much more advanced. And you're right, the appendix is an organ that, we can live without. It's probably one of the most common organ that we remove, most commonly for appendicitis. But what I tell my patients and their families is that the appendix, all it does is keep surgeons up at night and get people into trouble. That's pretty much it.
But that's really an interesting question. If we don't need it, shouldn't it be just a procedure at a certain age where they remove the thing? And I don't mean to laugh, but if it's a non-functioning organ that creates issues like appendicitis and way more scary is this type of cancer, I mean, these internal cancers that you hear about, I've done several shows about pancreatic cancer, these types of cancer that really don't show themselves any major symptoms until they're well developed. I mean, this is a really scary thing.
Yeah, it is a really scary thing. And, so I frequently get asked that question, like, why don't we just remove everybody's appendix? And, one of the answers to that is that even though it's becoming more common and we're seeing more and more of it, it's still considered a very rare cancer. And so we would have to remove, hundreds of thousands of appendixes to prevent one appendiceal cancer. And that's, from a healthcare perspective, resource perspective, that doesn't make a lot of sense. And similarly, people ask about, screening for appendix cancer. Again, you'd have to screen millions and millions of people to detect an appendix cancer early enough to have an impact on it. And even then, we really don't have a great way of screening for it. You need to get a CT scan or, some sort of imaging of the appendix, which isn't always easy. So those are some of the reasons why we don't do that.
It would almost, for the layman, I'm sitting here saying, shouldn't we get to the point where we can just do a full body scan just to check to see if there's anything going on? I mean, that's unrealistic probably. It's probably based on cost, but I mean, I'm sure that's what people are thinking.
Yeah, well, you raise a good point, and I wouldn't be surprised if, with all the developments that we're seeing now in AI and technology, that we'll get to that point like a Star Trek, kind of a recorder that just like scans the person and figures out something is wrong. But right now we don't have that kind of technology, and one of the problems with just sort of getting scans without looking for something specific that has a high incidence is that you then end up seeing other things that you don't have an explanation for, and then you're going down the road of getting biopsies or doing other studies for something that's not necessarily a cancer. So yes, there's cost, and then there's a risk benefit ratio that you have to think about as well. Mm-hmm.
When we talk about these hidden cancers, I mean, and there are a lot of them, these things like appendix cancer, pancreatic cancer, cervical cancer, ovarian cancer. There's so many of these things, and it's challenging. And obviously, you always say to yourself, well, what can we do to try to prevent cancer? Obviously, exercise, diet, you can do all those type of things. But no matter what, is there ever been an indicator of who is more likely to get this type of cancer? Or is it just a random unlucky draw?
Yeah. Unfortunately, at this point, again, because it's so rare, we've not been able to put a finger on who's at high risk for it. It does not appear to run in families. There have been some reported cases of, close relatives, but exceedingly rare. We have not come across, a germline mutation, an inherited mutation that predisposes people to getting appendix cancer. And the other thing a lot of patients that I take care of, they ask me, well, should my family members have their appendix removed? And, I jokingly say, I wish that was the case, because then we would know whose appendixes we could remove. And I would love to have a day in the OR where I just remove, 10 normal appendixes and prevent appendix cancer.
Nice.
But unfortunately, we don't know. And, again, I've heard many people have come in and, said things like, I was a hairdresser. I worked with, chemicals my whole life. I worked in this environment. I worked with depleted uranium. We
Yikes.
just don't know what causes it at this point.
Now, I know I'm looking at the notes that you sent over. I wasn't aware that the appendix is technically part of the colon. We've done a lot of, the fact that you can screen for colon cancer so effectively these days is pretty amazing. And I think, I've been lucky as a person who, during a colonoscopy, they found something that they removed before it became cancer, and it's really been a boon. But appendix cancer is its own entity, as opposed to being part of the whole, the same thing that you could look at through colon cancer screenings.
Yeah. So the appendix is, a very small, about the size of your little finger. It looks like a worm, actually, if you will. And it hangs off the very first part of the start of the colon, where the small bowel meets the large intestine or colon, in the right lower quadrant of the abdomen. And, with a colonoscopy, the opening to the appendix is so small that somebody who's doing a colonoscopy can't see into the appendix. You can see the opening or the orifice of the appendix, but you actually can't put the scope down into the appendix to see if there's a tumor there. Sometimes the person who's doing the colonoscopy can get a sense that there's something wrong, if there's some bulging in that area, or mucin that's draining out, the gelatinous material that the appendix makes that doesn't look right. That will either prompt them to do a biopsy or get a CT scan. And then from there, if things don't look right, then a person would get referred to have their appendix removed and be treated.
And again, we're talking to Dr. Laura Lambert, who is the professor of surgery and the director of the peritoneal malignancy program at the University of Utah. And we're talking about appendix cancer. A dear friend of this radio station lost his life in a fight against it. And we're trying to get some information. So, what are typically warning signs for a person? You had mentioned some abdominal discomfort. I'm sure we all feel some abdominal discomfort from time to time. How do we know when the red flag should kind of be raised? Yeah,
that's a great question. Usually what we advise people is that if they're experiencing something unusual in their abdomen that doesn't get better, right, and if it kind of comes and goes, it's probably not related to a cancer. If it's a symptom that comes on that stays and is progressively getting worse, change in bowel habits, meaning if people are noticing that they're having a harder time moving their bowels, or their stool is getting thin like a pencil as opposed to being normal size for them, if they feel like their abdomen is getting swollen. Sometimes it can be hard to tell as people get older and we put on weight. Yeah, but if there's a difference, it does feel differently. People are noticing that when they eat, they feel full really quickly. They're not able to eat as much, and they're starting to lose weight. That's also another sign. And then not infrequently, we actually see people get diagnosed through a hernia. So both men and women can get hernias. Men tend to have them more frequently, but we will very often get referred somebody who went in to have a hernia repaired, and the surgeon ran into this gelatinous material called mucin that comes from the appendix and appendix tumors. And they encounter that, and they realize there's something wrong, and they get referred to a cancer surgeon for it.
Wow. You said it was a small amount of people who are, a rare form of cancer. When we talk about yearly, how many people run into this?
Yeah, if you look in the literature, you would probably read like 1 to 2 per million, but it is clearly increased over the past few decades. And if you look at the trend in the literature, you'll see that it has steadily been rising. And I think in part that there's both an increased incidence, like meaning that there's actually more tumors of the appendix for whatever reason, but also we've gotten much better at diagnosing them, not considering them colon cancers, or oftentimes in women they'll get mistaken initially for ovarian cancer and get misclassified that way, and which is unfortunate, because then women who get diagnosed with ovarian cancer start on a treatment plan for ovarian cancer, which is actually very different than for appendix cancer. So it's really important that, the gynecologic oncologists, the cancer surgeons for ovarian cancer, are paying attention to what's really going on and not forgetting that it might be coming from the appendix.
It's scary to hear that, but there's so many things that can be misdiagnosed. And obviously the medical community does everything it can to find the best possible diagnoses, but it's another scary aspect of things when something can often be diagnosed as that. So that is scary. Now, my other question along that line is, we've seen that, for example, and I bring up pancreatic cancer again, that's something where the rate of recovery is extremely low. What is the typical rate of recovery for something like appendix cancer after you get diagnosed?
Yeah. So appendix cancers, even though they're very rare, they come in a spectrum. There's actually a pretty wide variety of them. From at the good end of the spectrum, if you will, something called a low-grade appendiceal mucinous neoplasm that is technically not a cancer, but is a tumor and a growth, and it has its own set of issues, which, if left untreated, can be life-threatening. Those actually we have a really good success rate in treating those, especially if we catch them early. Unfortunately, the treatment for that does often require a big surgery to remove all the mucin and tumor that you can see from the abdomen, and then treat the abdominal cavity with a heated chemotherapy solution. And then at the other end of the spectrum are what we call poorly differentiated or high-grade cancers. Like, these are real cancers that act more like you think of with a colon cancer or a pancreas cancer. Those are harder to treat for cure. They require intravenous chemotherapy, like you think of for treating for most cancers. And then hopefully that surgery that I mentioned can be an option for people with the more advanced or the more aggressive type of cancer. So there's a wide spectrum, and depending on what type of tumor there is, really determines the prognosis and the outcome.
So we hear more and more about immunotherapy. It sounds exciting. Don't know much about it, but it seems like that great advances have been made recently. Is this something that has responded to that type of therapy? What exactly is that, by the way? Because you keep hearing it. What are we talking about?
Yeah, no, immunotherapy is really exciting right now. Basically, it's a way of using your body's immune system to recognize that cancer cells are abnormal, and using your immune system to actually kill those cancer cells. Cancer cells are really good at hiding from the immune system. They have these cloaking mechanisms. And immunotherapy unmasks the abnormal cancer cells and directs your own immune cells to seek and destroy those cancer cells. And with cancers like melanoma that are what we call very immunogenic, meaning they have immune markers on them that your immune system can recognize, when we stimulate the immune system to recognize and attack them, they can do a very thorough job. I mean, it really can literally cure people with some forms of melanoma. Wow. And the outcomes have been like just dramatic, like, the kind of things we hope for in cancer therapy. For other types of cancer, we look for specific markers on the tumor cells to see if they are likely to respond to immunotherapy. Unfortunately, with things like colon cancer and appendix cancer, there's a very, very small subset, like 4 to 5% of tumors that will have those markers. So we haven't been as fortunate in appendix cancer using immunotherapy, but who knows? Somebody will figure out how to apply it there as well.
One of the things is it's always important to go to the place where they're the best suited to help you get through things. Is there typically people who are experts at appendix cancer in every major major city? I mean, we're in Boston. If anyone's listening and they're running into it,
no, there definitely in most major cities there are now. The centers that have what we call a HIPEC or a heated intraperitoneal chemotherapy program are probably going to have the people who have the most experience, simply because that is a mainstay of treatment for appendix tumors and cancers. And so at those centers, you're going to have surgical oncologists who have seen many, many people with appendix cancer. They recognize the difference between appendix cancer and colon cancer. We mentioned that in the middle of the conversation here. Yeah. In addition to that, because people are going to those centers, hopefully to get that surgery, the medical oncologists in those centers will have seen more people with appendix cancer. The radiologists will be more familiar with reading the CT scans, which is truly another level of challenge in this particular disease. So you really want a good radiologist reading your CT scan. And maybe even most importantly, you really want a good pathologist. So you want to be in a center where the pathologists have seen a lot of these tumors and know what they're looking for and are going to get the correct diagnosis so that you get on the right path for treatment, the best, the optimal treatment.
All right. So what's the best advice for those who have been run into this? The best place to go to get information and make sure that they, are seeking out the best possible treatment. Are there any sites that people should know about?
Yes, absolutely. So there are a couple of sites that I tell people. One in particular is the Appendix Cancer Pseudomyxoma Peritoni Research Foundation. So on the web, it's acpmp.org, and this group has the most educational material available online, as well as they are dedicated to funding research to find better treatments and cures and understanding the pathology of this disease, as well as and provide an incredible support network for anybody who has this diagnosis or their family or friends who are interested in reading about it or learning more about it. So that's one. The other website or group is a group called pmppals.net, and they are also online. They have very good information around education and also a great support group for people who are facing this. And I really encourage people and their families, when they first get this diagnosis, be very, very careful what you read online. It can get very scary very quickly, especially if you're looking not at the correct diagnosis for you. Yeah. And also what patients have told me to tell other patients is, to really be careful about reading other people's social media pages because it can get scary very quickly. But there are a lot of really good success stories and people that, have dealt with this, their family, their loved ones, and that can provide a really good support. So you don't need to feel alone. Also, the ACPMP Research Foundation supports a number of webinars throughout the year and symposia for patients and their families to be able to get good, safe information and connect with the community and, find providers in their area who can help them and guide them appropriately.
Well, great stuff. Dr. Laura Lambert, again, that's our eyes have been open to something which I seriously, before a couple of weeks ago, I had no idea that existed. But obviously this is a big deal, so people should be aware and educate themselves as much as they can. Dr. Lambert, thank you so much for joining us today on the program.
Thank you for having me.